and over and over again. So,
but meanwhile on Facebook you could spew as much Russian political propaganda as you want, and they're fine with that.
Yep. Okay, so you guys are live. We're just gonna let the room kind of fill up a little bit, let people kind of come in.
We start the live video with Rodney, and we just immediately, the room just fills up immediately. So we start it, and then we see it go whoop, whoop. It just stops, and we've been stopped by Facebook already. And they said, we didn't know you were going to talk about THC, and that's the first thing we started with.
Oh boy.
So a video that was going to be, a viral video and go everywhere is still slowly making its way around, but it's like a one by one. I know. So that was a little disappointing, but
sure.
Hopefully we got some people joining us here today. I am here in Oakland. Is this Oakland?
This is Oakland.
Oakland proper. It's beautiful. I've never been here. Nice weather, a little cloudy. It's cloudy, but it's clear.
It's not snowing.
And it's not snowing. And I'm not freezing.
That's
That's
true.
good. I'm here with Dr. Gary Richter. Some of you know who this guy is. This is one of my favorite vets, holistic vets out there, and has been using and believes in medical cannabis for our pets. I met you at the AHVMA this year, listened to your talk there, went to your breakfast with Dr. Hazza. And I think I already told you this, I've been to so many different events for pets where the wrong information is being given out. It's actually being taught to retailers and other vets that this medicine is dangerous or we should stay away from THC. So when I got to see you speak, I was like, oh, finally. Out the right information. Someone has been using the medicine and someone is going around and educating who is an actual vet, because I am not a vet. I'm just a cannabis person who loves animals and has been treating animals for a long time holistically. So thank you so much for taking your time on a Sunday, beautiful Sunday afternoon to spend it with us. We really appreciate it. I know our Facebook audience does, really appreciates it. I know that they're going to ask some questions, but I've got you first.
Okay.
So I want to talk to you. I want you to tell us and the audience, how long have you known about medical cannabis and its benefits? When did you start using it? When did you become a believer?
Sure.
How long have you been practicing? And then some of the advocacy work you've been doing to make sure people in California and vets can actually talk about this incredible medicine.
Okay, gosh, that's a lot of
I
questions.
know,
sorry. So where to begin? I've been a veterinarian for a little over 21 years, and been doing holistic and integrative medicine for most of that time, maybe about probably 15 to 17 years, give or take. The thing that motivates me as a veterinarian is, I'm always looking for what else can I do to help my patients. There's a sort of very finite box of things that are in the conventional Western medical toolbox. And I'm always looking for things that are sort of a little bit outside the norm, but still have really solid scientific basis in their efficacy.
And I don't mean to interrupt, but were any of these things taught in your schooling, in your education?
No.
All conventional.
So there are some veterinary schools now that are starting to sort of expand a little bit into complementary and alternative medicine. The bottom line is it's a 4-year education, and there's a lot of information you have to learn in that 4 years. So packing in, a whole nother treatment modalities, it's a lot to ask of these schools. And because of that, it's really up to the individual veterinarian to sort of take their education into their own hands after they go out of school. Truthfully, as a doctor, and I hope this is true for all doctors, we need to be lifelong learners. Because if you're not constantly learning how to do your job better, you're doing something wrong.
And this also goes for us, as human beings, as pet parents, as advocates for our own health, is we got to take responsibility. We need to do our research and find the answers and find those holistic vets and doctors that are out still educating themselves.
Agreed. So to further answer your question, it was kind of inevitable living here in California, and particularly in Oakland in the Bay Area, that cannabis was going to become part of practice and part of the conversation. And it really all started quite a number of years ago, because what happened is, you know, in California we've had medical marijuana available for people since 1996. So it's been going on for a really long time. And what happened is, you know, more and more people were taking advantage of medical cannabis, and they were having really positive results. And not surprisingly, they then started asking, hey, you know, my pet has a medical problem. Can this medical cannabis help my pet as well? And quite understandably, they went to their veterinarian and they said, hey, what about this? And most veterinarians said, I have no idea. I don't know what to tell you. I don't even know if it's legal. And it became a real issue. And like most veterinarians, I was fielding, you know, multiple questions per day of people coming in and asking these questions. And it really got me to start, you know, thinking, you know, I had seen positive effects with people for medical cannabis. There was no doubt in my mind that medical cannabis was legitimate for use in people, so why not use it in animals? And that really kind of started me down the road of doing research, talking to experts in the field, and really sort of learning, you know, from the ground up. I mean, I had never heard of the endocannabinoid system when this all started. So, I mean, that's not something they teach you in school.
No.
So, you know, learning about the endocannabinoid system, learning about phytocannabinoids, you know, learning how all of this interaction takes place, and then eventually getting to the point, you know, of you know, having people come into the office, you know, and many of them had on their own put their pets on some form of cannabis, and that was really valuable information for me to see what worked, what didn't work, you know, what were the problems that were coming up, and that's really kind of how it all got started. And then, you know, about 3 years or so ago, we ran into a problem here in California, and the problem there was a bill called Prop 64 that passed, and basically that made recreational cannabis legal in California. So now, with Prop 64 passed, anybody over the age of 21 can go into a dispensary and buy anything they want. Was no longer relegated to somebody with a medical card, etc. So cannabis was just broadly available to any adult. And that created an even bigger explosion of pet owners wanting to use these products. And then all of a sudden, the Veterinary Medical Board in California sent out a letter to all of the veterinarians in the state saying effectively that if we as veterinarians recommended, discussed, or otherwise had any conversation about the use of medical cannabis in our patients, we were putting our medical license at risk.
No warning, no explanation, just sent this out.
I mean, basically, the explanation was...
Like, did a group of people come together and make this happen?
Well, I'm sure they did somewhere, but
nobody
knew about it at the time. Their explanation was that you know, Prop 64 and the medical cannabis laws in the state were very specifically written for people, and because cannabis in general is federally illegal, then their conclusion was that there's no legal avenue to use cannabis in animals. That was where they went with it. What they didn't take into account were the countless people that were already doing this, that were going to their veterinarian and asking them what to do. But the practical result of that letter was a large portion of the veterinary community in California just took a step back and said, I don't want anything to do with this. And I totally understand that. I mean, it's your livelihood that they're threatening. I mean, I hold that against nobody if they didn't want to go down that road. You know, and that created a situation that ultimately led to advocacy and legislative change. So I was very fortunate to be familiar with a couple of people, Paul Hansberry and Susan Tibbin, who are just wonderful people. They're sort of artisan cannabis growers. They've been growing medicinal cannabis for years, but they are also really, really passionate advocates for lack of a better term, for what's just right. And when I talked to Paul and Susan about this issue, the first thing that they did was they went to Sacramento and started knocking on doors. and started talking to legislators, started talking to assemblymen, talking to state senators about what we can do to fix this. And ultimately their efforts and the efforts of a whole bunch of other people led to the creation and the passage of a bill called AB 2215, which actually went into effect officially January 1st of this year. And now veterinarians are allowed to, quote, discuss the use of cannabis. To be quite frank, it didn't go as far as we wanted it to. It doesn't give us all of the leeway that a physician in this state has as far as talking about cannabis, but it's a really good start. It's a foot in the door. We have another bill that we're hoping to get passed this year that would allow us to, quote, recommend. And that would put us on the same playing field as physicians in California, which is really exactly where we need to be in order to be able to serve our patients as well as we need to. So we're very hopeful that that bill gets passed, and we're also very hopeful that that bill ultimately becomes a template for other states to pass similar legislation. I mean, there's a lot of states out there that are looking. Colorado, Oregon, Washington, New York, etc., all kind of looking at these things, not to mention Canada.
Right.
And we're also hoping that eventually when federal laws change as it pertains to cannabis, we're hoping that because these laws are going to be on the books in the individual states, that animals and the veterinary community will not be forgotten like we were back in the day when Prop 215 passed in California that allowed medical cannabis for humans. And frankly, nobody ever thought to add veterinarians and animals into that bill. It was just an oversight.
Right.
But it caused all this problem.
Yeah, well, imagine us in the rest of the country. You know, I'm in Florida where, you know, it was crazy talk. It's witch medicine. We don't even do it. I came to California to learn all about it because, like you said, it's been legal medically. So we get a lot of vets. I educate a lot of vets. If there is a vet, or you go to your vet, share this information with them so that we can make this something that vets feel comfortable with, learning about, recommending, or even inviting into their toolbox.
Sure.
Because it's an all-natural medication or medicine, whole plant medicine that works for so many things. What are some of your best success stories? What have you seen? Tell me about the first time you saw it stop a seizure or do something that made you go, whoa.
That's a good question. I mean, I think, way back when we first started all of this, the first animals that we really saw kind of benefiting from cannabis were sort of the older, creaky, arthritic animals that were having a really hard time getting around. As you're probably aware, and from a Western medical perspective, if you have an arthritic animal, usually they go on non-steroidal anti-inflammatories, whether it's Rimadyl, Metacam, what have you, or maybe gabapentin, tramadol, that sort of thing. But sometimes these drugs don't work as well as we'd like them to. Sometimes, particularly with the non-steroidals, they just can't take them. Whether or not it causes GI issues or there's problems with their liver and their kidneys, you just can't give.
Because they're older.
Because they're old animals, you just can't give those drugs to those animals. And there really just wasn't a lot of options out there. So, those are the ones that we saw initially start on cannabis, and all of a sudden they started moving around easier and they started feeling better. And I think one of the things that a lot of people don't necessarily expect, but then you look back on it and it makes perfect sense, is you see their whole demeanor and attitude change. Because, let's be honest, anybody that's in chronic pain is in a foul mood. For very good reason.
I am.
Yeah, anybody would be. I would be.
Right.
And then all of a sudden you take that pain away and they're happy. And they're playing.
So I always hear they become puppy-like.
Yeah, and they're interactive again because, I say this about holistic medicine a lot when it comes to animals. The big difference between treating animals and treating people is that a lot of people with chronic illness and chronic injury, they have a very big emotional component wrapped up in their condition. They have defined themselves by having this condition. And because of that, sometimes that creates a barrier to actually making them better because part of them actually wants to stay that way.
Right.
Animals are not that way.
No.
They just want to feel better. They have no emotional hang up at all.
No placebo effect. They're not pretending
to
feel better.
So they just want to be better, and because of that, you can see it so clearly when they do, because like there's no emotional hang up, there's no curtain or anything. They just get better. So we saw a lot of these guys with arthritis, soreness, back pain, whatnot get better. Other things that I have seen that I found surprising were really dramatic reductions in seizures, seizure frequency, seizure severity. Now, to be clear, it has not been my experience, nor is it really borne out in the literature, that CBD or cannabis is a cure for seizures per se. But it's very common to have an epileptic animal that's on 1, 2, 3, or more pharmaceutical anti-epileptic drugs, and they're still having seizures. This happens in people all the time.
And don't they have to change their dose or up it or whatever to find?
It's super complicated, and the thing about seizures, which is tricky, is every patient is individual. There is no one treatment that works across the board. Right. And the problem is, like I say, they can wind up on all these meds. Some of them are potentially toxic over the long term, and they're still having seizures. And some of these animals, when they go on usually a CBD-rich cannabis of some variety, you'll start to see their seizure frequency decrease. You'll see the seizure intensity.
And when we're talking about
decrease.
this, we're talking about a full-spectrum product that has at least the 0.3% THC. Or here in California, a little bit more THC?
I think, I think either or, and it's very, very, like I say, it's very individual. So for example, there's some people out there who are very big advocates for THCA as a treatment for seizures.
Which is the raw acidic form of
exactly,
THC.
so non-psychoactive, but there are seizure patients out there that do very well on THCA. There are other ones that don't, other ones that need CBD. I mean, when we look at the human research data, it actually correlates very well to the study that was just done in Colorado State, that CBD definitely decreases seizure frequency and seizure intensity. It doesn't probably do it as dramatically as we want it to, and as dramatically as some people say that it does. But it is definitely effective, and there's a really interesting meta study that was done from the human literature that found the differences between people that were using a CBD isolate versus a full spectrum. And what they found is that the people taking the isolate tended to take much, much higher doses and had a much greater incidence of side effects than the people that took the full spectrum while getting the same beneficial effect. So I mean, I think that's just another point towards what most of us believe, which is nature made it that way for a reason.
Right.
And generally speaking, taking one compound out, isolating it, and concentrating it usually doesn't work as well as the full spectrum.
Which means a full spectrum product. Stick with a full spectrum product.
Agreed.
I also find that I think the biggest thing with treating seizures is when I first started this journey, I got involved with an organization called Cannabis, who were treating their children, and I was watching children go into full epileptic seizures, and the mother calmly take out a tincture, shake the bottle, put it on the gum, and watch that child within 20 seconds stop the seizure.
Yep.
When I saw that, I thought to myself, this is inhumane to keep it from a human being, much less an animal. And now in the 5 years that I've been using medical cannabis, I've stopped so many seizures, and you're right, they're all different. The type of seizure it is, how much you have to give them,
sure,
how often you dose it to give it to them, all makes a difference.
It does, and sometimes the formula you use to prevent seizures is different than the formula that you might use to stop a seizure going on. So it's
Say that again?
So the formula that you would use sort of on a day-to-day basis to limit seizures might be different than the formula that you would use in the moment if they were having a seizure and you wanted to stop it.
Exactly. So would you say that if you're having a seizure right there, that it would be something that you would want a little bit more THC or a little bit more CBD, and then on a regular basis something?
I mean, again, everybody's individual.
Right.
But historically speaking, yes, the stop a seizure, more THC, perhaps some more THCA, that sort of thing.
Okay.
Whereas preventing seizures, again, generally speaking, more CBD.
And have you seen success where a animal, especially a senior or geriatric, can get off all of the prescription meds and take a full spectrum medicinal product to control the seizures?
So yes, but I would say that it's the exception. If that animal is already needing some sort of pharmaceutical anti-epileptic drug, there's a good chance they're probably going to need to be on some level of that drug for the long term. Now, I have had epileptic patients that I have seen never have to go on the pharmaceuticals because their seizures were not that severe to begin with. But to me, part of it's about how well can we control the seizures, and part of it is even if we can just lower the doses of some of those pharmaceuticals they're on, it's still beneficial.
And it doesn't interact with the prescription medication.
That's a really interesting and sort of in-depth question. So one of the things about CBD that we know that it does is it interferes and interacts with a particular enzyme pathway in the liver that is also responsible for metabolizing a lot of pharmaceuticals, including a lot of anti-seizure medications. So in theory, there's always a little bit of a concern that CBD could affect the blood levels of, say, phenobarbital, potassium bromide, what have you. When we look at the research data, so for example, when Colorado State published their study on seizures in dogs, they found that the dogs that they had on CBD, there was no change in the levels of the anti-epileptic drugs. It would appear from the literature that in order to make something like that happen, you probably have to have them on very, very high doses of CBD. That said, I think it's always something that as a doctor we have to think about and we have to keep an eye on and maybe monitor drug levels for a little while. But on a practical level, it's probably more of a theoretical concern than it is a real concern.
Good. I'm glad to hear that.
Yeah.
What about cancer, tumors, those types of things?
Sure. There's no doubt in the literature that cannabis, THC, CBD, many of the other ingredients in cannabis have anti-cancer benefits. In fact, many of the same pathways that we see with cannabis are actually employed with conventional chemotherapy drugs as well. So they're sort of functioning in very similar ways. I have certainly seen patients live longer and have a much better quality of life than they otherwise would have been expected to. I had somebody send me an email just the other day that their dog had actually passed away, but she told me that 2 years ago her dog was diagnosed with cancer and was given a couple of months to live, and the dog got 2 years. So she was
happy, pain-free
So
years.
she was so grateful, for that, for getting that gift. So, is cannabis a cure for cancer? Probably not. You know what? As I often tell people, if we had a cure for cancer, everybody would be using it. And much
Well,
like
there it is. It's called diet.
yeah, there's a better
Exercise,
preventative
lifestyle.
for cancer. Cure is a tricky business though. But the goal is, if we can maintain quality of life, if we can maintain quantity of life, if we can keep these guys living longer, as long as they're living good quality, longer than they otherwise would have, then that's a real benefit. And again, when it comes to animals, the great thing about them is if your dog has cancer, they don't care.
Right.
There's no emotional hang up there.
Matter of fact, they're probably reacting more from the way you're feeling.
Well,
about
that's the
it.
thing. Like the whole concept of self-pity is not a thing that dogs do.
Right.
So, so what I generally tell people is, let your dog be a dog, or let your cat be a cat. It's important for them to, however long they may have, make that good time, is the thing. And if you're sitting around crying nonstop, then that is going to affect them in a way that's not going to be
That means
positive.
you need CBD and your dog needs CBD so that you both feel better. I always like to say, and what I learned is that a full spectrum medical product is going to bring the body into homeostasis, where then we can start working they're trying to figure out. And a lot of times it's diet or, you know, natural things that exist in nature that can bring them back and then support and let their body do the healing, let their own body learn how to heal itself. Do you agree with that?
I totally agree. I mean, the endocannabinoid system, I mean, you can literally talk for weeks about what the endocannabinoid system does, but if you're just going to sort of wrap it up in a very small package, it promotes homeostasis. It balances the body in such a way that if there's stress, disease, inflammation, injury, what have you, it brings everything into balance. And you know, the beauty of you know, this co-evolution that has happened between us and animals and the cannabis plant is that, you know, because we evolved consuming those kinds of compounds, they actually benefit us in the sense of balancing out the endocannabinoid system. So, you know, so you're right in the sense that you know, it just helps balance everything out, but it does more than that in the sense that as it's balancing things out, it's also in many cases resolving or improving medical issues.
So if we've got a dog that is not walking, has degenerative disc disease, degenerative myelopathy, I'm naming some of the things that my dog has been, I've been told by conventional vets. Brain tumor, he was told that too.
Sure.
And now he's not on anything but full spectrum medicine. But when someone has a dog that is no longer walking, and I'm seeing it constantly in pugs. We got Bruce, who's one of our favorite clients, and dogs. We have Frenchies. When they take this and they get up and walk again, what is happening?
Well, that's a tough question to answer because on some level it depends on what's going on with the animal, but I think in most cases what you're seeing is the result of resolution of inflammation and pain. So there's a lot of reasons why a dog may not be able to walk. It could, you know, in many cases it's just because it hurts.
Right.
Where in other cases, so for example, like degenerative myelopathy that you brought up, I mean, that's a progressive neuromuscular disease. And while there are some fascinating sort of preclinical studies showing that the endocannabinoid system may actually play a part in DM, you know, it certainly isn't going to make those dogs get up and walk, because those dogs have spinal cord demyelination. It's a physical problem with their nervous system. So it really depends on what's going on with them. But you're right. Like a lot of these dogs that have arthritis, that have back problems, what have you, hip dysplasia. The thing that prevents them from getting up is pain. And then secondarily, because they're not getting up and their muscles are wasting, then the thing that prevents them from getting up is weakness, because they have no muscle left because they've been laying around doing nothing.
So what should someone do? Like, I know we just took a tour of your shop and we saw all practice, and we saw so many wonderful things, from hydrotherapy, which is another thing I did with I live on a lake, so I just stuck him in the lake and started seeing him use his back legs.
Be careful in Florida lakes.
Yeah, I know. Oh yeah, I know. We're actually in lockdown right now because we have a missing goose. So we are, you know, what does someone do? So if someone's listening to us right now, what is the first step they should take? What are some other alternative medicines or treatments or things that someone can do? To me, I see a dog walking down the street and I know it's in pain. How's a pet owner go, oh, I thought they were just old. I wasn't realized that they were actually in pain and suffering.
Sure, I hear that a lot. Like people, their dog is limping and they'll say, but he's not in pain. And you know, to which my comment is the only two reasons why he's limping is he's neurologically compromised or he hurts.
Right.
And he's probably not neurologically compromised because that's far less common than just arthritis or joint pain. So just because the dog's not vocalizing, because he's not saying ow, doesn't mean that it hurts any more than like I can look at somebody walking down the street and I can tell whether they're in pain or not. So to your point of what can people do, I mean, you know, without a doubt, step one is talk to your veterinarian. Particularly if you are able to get an actual diagnosis as to what's going on, that can kind of narrow the focus a little bit as far as figuring out what the options are. But there's a laundry list of options as it pertains to like arthritis pain, orthopedic pain, that sort of thing.
And these are options that if they're at their conventional vet and they don't want to do a prescription painkiller, is this things they bring up to their vet and say, can I try, do you suggest?
Well, yeah, and I think I always encourage people to have that conversation with their veterinarian, and I always tell people that there is no upside to keeping secrets from your veterinarian.
Right.
So don't start giving them stuff and then don't tell your veterinarian.
Right.
Even if your veterinarian has no bloody idea what it is that you're giving. I mean, still tell them.
I've also had lots of pet parents educate their vet by going, he's alive still, or he's walking now because I started using cannabis, and then
Sure.
that is the first time a vet
And you
may
know
have
what?
an experience.
I mean, I've been doing this job for a long time, and still every now and again I learn something from a client.
Yeah.
There's no room for pride in medicine. I will take my information from wherever I can get it.
Good.
So people very commonly come in and say, hey, what about this? Or I found this. And, a lot of times it may not be something that's right for that animal, but every once and again, you're like, wow, that's actually a good idea. Let's do that. There are, like I say, there's a laundry list of options for pain and arthritis, ranging from, glucosamine products to natural anti-inflammatories like boswellia, curcumin, ginger, these sorts of things. There's a product that your veterinarian can prescribe to you called Ataquan. You're probably familiar with that. Ataquan is kind of an injectable form of glucosamine. In my mind, Ataquan is probably the most underutilized substance for dogs with arthritis in the veterinary world.
Really?
I don't know why it's not the first thing that everybody picks off the shelf. We go through so much Ataquan in this practice that we literally have a hard time keeping it on the shelf.
And they inject it into where? The joint?
No, that's
or
the beauty of it.
veins,
The beauty of it is it's just given as a subcutaneous injection. So it's similar like if they were going to get a vaccine.
Mhm.
In fact, we very commonly show people how to do it at home. Like, you don't need me for this.
Awesome.
And usually within a month of starting Ataquan, there is a dramatic difference. Like I say, it's really an underutilized thing. So there's that. There's acupuncture. There's physical therapy. There's cold laser therapy. There's pulsating electromagnetic field therapy, which can improve circulation in painful areas and even sometimes regenerate cartilage.
Can I do all these?
Most of them, yeah.
I'm already on dog probiotics,
There you go.
CBD, and everything else.
Sure, and then of course there's cannabis, and there's the whole spectrum of cannabis. We know from the Cornell studies that 2 milligrams per kilogram of CBD twice a day, statistically speaking, improves arthritis pain in dogs.
Yeah.
2 mg per kg twice a day is a pretty stiff dose. It's about 1 milligram per pound twice a day. That's probably more than most people are giving. We've also seen that if you start looking at products that have a little bit of THC in them, a lot of times you can actually get that dose of CBD down, considerably. Again, entourage effect. It all sort of works synergistically. So, if you live somewhere where medical cannabis is a thing that you have access to, that's something that also might be worth looking into. But I would very strongly suggest that if you're going to get a product with THC in it, you do it with some kind of guidance. THC can be very helpful in dogs. There is such a thing as THC toxicity in dogs, so you want to make sure you stay on the right side of that line.
I would love to talk about that toxicity and what is it called?
So generally speaking, the term that people use is static ataxia. Once you see a dog with static ataxia, you will never forget what you saw, because it's very, very specific to THC toxicity. What you wind up with is a dog that kind of almost is standing like in a sawhorse type stance, and they're swaying back and forth, almost to the point where they fall over and then they catch themselves and right themselves. They're completely sort of cognitively out of it. I've actually seen videos of dogs that have static ataxia that literally just tip over with their legs still stuck out like they think they're standing. Generally speaking, THC toxicity in dogs is not fatal. That's not 100% true. There have been fatalities, but for the
What are
most,
those fatalities?
the only one that I have ever personally witnessed is a dog that got into a bunch of edibles that belonged to the owner, and
Edibles are a whole different game.
yes, that is a
That is
very different
not
thing.
medical cannabis.
That is not to be toyed with. But this dog ate a whole bunch of edibles. The owner, thinking that oh, it's no big deal, he'll just sleep it off, didn't actually call us for like 24 hours till 24 hours later. So by the time he called us and he brought the dog in, I mean, the dog was completely unconscious, had been for the better part of 24 hours. And unfortunately what happened is during that period of time, he had vomited and aspirated, so he got that material in his lungs, and he ultimately died of pneumonia and sepsis. So you could argue back and forth whether or not it was technically the THC that killed him, but clearly eating it was what led to that. So the moral of that story is cannabis, and THC in particular, is not a completely benign substance. You can kill a dog with it if they get into too much.
And we have to remember it's an unregulated market. We have no idea. One of the reasons I created my own tinctures is because I could not find a pet product. I could only find human products that someone put a label on, and it had all of these other ingredients that I knew weren't good for the pet.
And the thing is, again, if you live in a place where you have cannabis dispensaries, then probably you can buy some extremely high dose material. So we have the new cannabis laws in California says you can't sell anything that has more than 100 milligrams of THC in it. There used to not even be that limit. So you could buy like a brownie that had like 1,000 milligrams of THC. Ridiculous.
It is ridiculous.
I mean 100 milligrams of THC. If I ate that, you can put me to bed for 2 weeks. I'm done. I'm under the covers for 2 weeks.
Me too.
So
I'm not a fan of edibles at all.
They are to be used in moderation.
Right.
But anyway, so yes, you can use THC in dogs. Yes, you have to be careful, and you should do it under supervision.
Wonderful.
Yeah.
So I'd love to take some questions for anybody that's watching live that wants to ask Dr. Richter any questions about their pet or about anything that we said. Carter, we got some questions?
Yeah, so we have a question from Darren Sumner about, he has a dog with a heart murmur, and he wants to know if it's safe for him to use cannabis for his pet.
That's a really interesting question. So we do know that cannabis, THC in particular, can affect heart rhythm a little bit. So, again, I can't really give you direct medical advice, but speaking in generalities, CBD in an appropriate moderate dose is probably fine. I would avoid any products with THC in it just because of the underlying heart disease.
And when you say no THC, are you talking about not even the 0.3%?
No, that's fine.
Okay.
I mean, just I'll call it no significant
So you have
quantity
to remember,
of THC.
we're in California, so our THC can be the 0.3% on up.
Yeah.
So in other states, a full spectrum product has the 0.3% THC, and that little bit of THC really does make a difference. So that's why we have to, everywhere we go, we have to talk the language that everybody knows in that state. So that's why it's a little bit confusing about. All the research is a full spectrum product.
Sure.
Every time we've seen it as reduce seizures or what else? I mean, there's been so much research. I get my human and my animal research mixed up, but we do have it on my site. All of the research that you've talked about, all the research you talked about at AHVMA, all the research that exists out there, we have it where you can read it. We explain it in layman terms, and then you can go read it yourself if you want to. Hope that answers the question. We got any more questions? So we are excited to be here. I'm going to spend some more time talking and showing him some actual cases of some wonderful success stories, and I don't know what the heck's going on. But I wanted to thank you so much.
Yeah, thank you.
Turns out he's from Miami, went to Palmetto. I went to Killian.
Go Panthers.
Here, Cougars. And
Let's not do that.
and we're
We want to see if Dr. Richter had any specific resources where pet parents could sign up and get some sort of regular information about this stuff.
Yeah, thank you for asking. Absolutely. There's a number of good resources out there, but one of the things that my team and I have been developing lately is a website called My Pet Thrives. As I think you can see right behind me here. My Pet Thrives is designed to be a resource for people to get advice and information about holistic and integrative medicine, especially if you don't have that available to you where you are. So it's free to join. You can just go to joinmypetthrives.com and you can get free access to a whole bunch of content. If you want to, please go on there and have a look, and hopefully you'll enjoy what you get.
I know I get asked on a regular basis, what holistic vet do I recommend, and I always refer them to the ahvma.org. But even then, you still need to go visit that vet, see if it's a good fit. Not all holistic vets are created equal, so this is a wonderful resource where you have my most trusted holistic vet, and you have access to him now, so that you can take the information that you read or learn from him and bring it to your vet and discuss it. But yeah, never settle. You are in charge of your pet's health, and you can get exactly what they need. And maybe it's not in your state. Now you get access to something like this.
We have some questions now.
Shoot.
Madeline Prince would like to know what milligram per pound is suggested to reduce normal arthritic pain. Does it reduce pain and reduce inflammation, which of course will reduce pain? I guess my question should be, does it reduce pain by reducing inflammation?
Okay, so the answer to that question is yes, and then some. So cannabis and CBD in particular, probably because that's what we're really talking about here, is we know it has anti-inflammatory effects. So as an anti-inflammatory, yes, it controls for pain that way. Interestingly, THC and CBD are also what are called allosteric modulators of opioid receptors. So that's a mouthful, but basically what that means is that it affects the way opiate receptors respond to our own natural endorphins, our natural painkillers. So it can help modulate pain in that sense as well. So there's really more than one mechanism. And then I think, to circle back to the beginning of your question, what we know for sure from the research, from the veterinary research, is that approximately 1 milligram per pound of body weight will improve arthritic pain in dogs. In my experience, I have seen lower doses than that be effective, but that's the dose that was published. So, depending on how big your dog is, if you have a little tiny dog, 1 milligram per pound is not that big of a deal. If you have a 60 or a 70 pound dog, giving your dog 60 milligrams of CBD twice a day is going to get very expensive very fast. So you might want to start with a lower dose and work your way up if you need to.
Also remember, and I have found, and I don't know if you have also, that the older the dog is, the more geriatric the dog is, the more issues they have, the more deficiencies they have in their endocannabinoid system. So you may be treating arthritic pain or inflammation, but you're also plugging up some other problems. So we've seen dogs where they were taking it for a tumor in Cushing's, that she wasn't getting up every night anymore. So you start treating one thing. So we got a young dog with one issue, you're gonna need probably less medicine. You have a dog with multiple issues and deficiencies, you're probably gonna need a lot more.
Well, and that's the great thing about natural medicine is because natural medicine is really treating the animal as a whole, whereas, Western medicine, it's a very sort of pinpoint thing. So if I'm going to give an arthritic dog Metacam, I'm targeting a very specific pathway to help with inflammation. But cannabis, for example, it's going to treat that arthritic pain, but it's going to help with GI upset. It's going to help them just generally feel better. Whole body support, which is really what they need.
Yep.
We have another question. This is from Lou Campbell. Lou Campbell asks, are there any interactions with anesthesia agents if my dog has to have an emergency GA? Or is there something I should explain to my own vet if this ever happens? Thanks. He also says, are there effects on the gastrointestinal system and dosage? Can you recommend additional literature and learning sources for pet owners?
Okay, that's a lot of questions.
Yeah,
I'm going to
that's a lot.
try and keep straight. The first question is an awesome question. The question regarding anesthesia. I'll tell you what we know. Is there was a study that came out in the human literature, I think last year, which was a really fascinating study that looked at, they took a population of people that had to go into the hospital for an endoscopic procedure, so something that you need to be sedated for. And they separated the people out into groups of regular cannabis users and people that were not regular cannabis users, and they actually found that the dosages of sedatives and anesthetic agents were significantly higher in the regular cannabis users than in the non-cannabis users. So that's a real interesting thing. It's actually something that I bring up when I talk to groups of veterinarians, is if you have a patient that you know is on medical cannabis and they have to be sedated or anesthetized, you need to be prepared to maybe have to give a little bit more than you otherwise would in a normal dog. So awesome question. We don't know that for certain in animals, but it seems to bear out in people, so it's probably true. What were the rest of the questions?
Interactions with the gastrointestinal tract.
Right. So cannabis can actually be really great from a gastrointestinal tract standpoint. Turns out that the entire gut is loaded with endocannabinoid receptors, and there appears to be a very big relationship between the endocannabinoid receptors, the gastrointestinal flora, so the bacteria that live in the gut, as well as something called the gut-brain axis, which is sort of the direct neurologic connection between the gut and the brain. So cannabis can actually be very beneficial for gut health. There's a number of studies out there for people with Crohn's disease and that sort of thing that have improved significantly on cannabis products. So overall, it's a positive.
Wonderful. If they are, what is the best way to dose a sick pet? Do you have recommendations? We always like to go right into the gums. Do you agree with that?
Sure. Yeah. I mean, I think we're not completely certain. The pharmacokinetic data that we have so far, really looks at either orally administered products in a couple of different formats, and then Colorado actually looked at a transdermal product as well. What hasn't really been looked at is transmucosal absorption, because it's tricky in a dog. Like as a person, you can hold it under your tongue and keep it there. That's not going to work with a dog. So it's real hard to sort of parse out how much of it was absorbed transdermally versus what was swallowed and what was absorbed. That said, my preference is if people, I prefer that people use an oil, because I think it's when you're using a liquid, it's much easier to modulate the dose. And I generally will recommend that people give it orally in the hopes that we'll get some transdermal absorption and then the rest of it go gastrointestinal, because intuitively that feels like the best way to get blood levels. But to be perfectly transparent about it, the research isn't there.
Good.
Cool. We have another question from Samantha Price that says, my dog has environmental allergies, always scratching. I've heard CBD can help with allergy symptoms as well, ?
So, as we've discussed, I mean, CBD is an anti-inflammatory, and it does help sort of balance out the system in general. So I don't think that CBD would be a wrong choice for allergies. Honestly, in my practice, it probably wouldn't be the first thing that I reach for. Usually when I'm looking at allergies, the first things that I look at are diet, whether or not there's any sort of nutritional or herbal supplementation that needs to be added in, flea control, depending on where you live. Those are probably the bigger fish, if you will, as it pertains to allergies. But again, I mean, using CBD wouldn't be a wrong thing to do, although I'm not sure how dramatically it's going to be effective.
Some of the things that I have found, especially with these designer breeds and these Frenchies, and that are born with these allergies.
Sure.
And when we address food, diet, and rule out all of those, we've had lots of dogs get off of something like Apoquil and get on a full spectrum where they're no longer biting their paws or itching anymore. So I think it definitely helps with that. It's not, again, solving the problem.
Right.
It's just bringing us back and then looking at what the problem is. And then
Sure, and again, it comes back to treat the whole, not the symptom. Right. So in that sense, it makes sense.
Wonderful. Do you have anything else?
People are just still asking questions about dosing and how to understand dosing. Is it by weight? Is it by ailment?
Well, I mean, that's a really broad topic because it's a little bit of both by weight and by ailment. But I mean,
and it depends what you're treating.
Yeah, exactly.
Or is it anxiety?
Sure.
Is it inflammation?
And so most drugs in veterinary medicine are dosed on a body weight basis. So what we calculated as is milligrams of medication per kilogram of body weight. So that's usually sort of the way we think that can easily be converted into milligrams per pound. But just broadly speaking, as I was mentioning before, we know that 2 milligrams per kilogram, or about 1 milligram per pound, was effective for arthritis. Similar doses were used in the Colorado State study for seizures. So again, ballparking around 1 milligram per pound twice a day. And I think that if you're going to be treating other things, so stress, anxiety, GI upset, and what have you, I think when it comes to CBD, those are numbers that it's a good starting place. Every individual is going to be different, both by virtue of what their individual problem is as well as their own physiology. My suggestion is always start low and slowly increase, incrementally, maybe every week or so. Because the reality is we really don't know what their most effective dose is going to be, and it may be that your dog does fine on 0.5 milligram per pound twice a day. So why give him twice as much medication as he needs? When it comes to THC, that's clearly a little bit of a more touchy sort of subject. THC dosing on 1 milligram per pound basis is much lower to begin with. A lot of times what I will suggest people give is somewhere between, somewhere in the neighborhood of like 0.1 milligrams per pound twice a day. That's usually kind of a safe starting dose, and you can slowly increase from there. Again, if you're going to use THC in any quantity, you need to do this with a veterinarian, because it is easy to screw this up, particularly just in the drug calculation perspective. If you're not somebody that's used to doing that math, it's very easy to make a decimal point error, and instead of giving 0.1 milligram per pound, all of a sudden you're giving 1 milligram per pound, and you're going to the emergency clinic with your dog.
Right.
So, get some help with this. Don't get yourself into trouble.
Wonderful. That's it? We're good?
Okay.
I feel that a lot of people are asking mostly about dosing because they're afraid, and we're talking about a full spectrum product, not THC.
Sure.
They're afraid of overdosing.
Uh-huh.
So they can't overdose on it, so you're not going to give them a full dropper and they're going to overdose on the medicine. So I feel like a lot of people, that was the original fear, that they're going to give them too much. Then the other flip side of that is people not giving enough to treat something major, so they go, oh, it didn't work.
Right, and you know what, the solution to both of those concerns is, as we often say, start low and go slow. So start at a low dose. Every 5 to 7 days, increase the dose a little bit. That way you're not going to get yourself into trouble by giving too much accidentally. Not that you would get yourself into any trouble using a hemp-based product anyway.
Right.
But that way you're going to sort of slowly work up to the most effective dose. And that's helpful, A, because that way you're going to know where that dose is, and B, because again, there's no benefit in giving more than you need to give, and ultimately it's just expensive.
Right. It's really expensive. It's not actually really expensive. I always tell people, if you're going to switch to a raw, fresh diet, you're going to switch and get off some of these toxic prescription medications, that at the end of the day, you're actually saving money, because you're not having to go to your vet constantly.
Sure.
Because your dog is sick.
Yeah.
You've now, got a healthy dog.
It's preventative care.
Exactly.
Yes.
Well, thank you so much for taking your time.
You're so welcome.
I think, did we share all of our favorite resources? We got this one, My Pet Thrives. It's a great way to stay in touch. He also has a fabulous, whoa, that book's not in English.
No, that one's a Polish translation.
Awesome.
So.
Also, great book. I don't know if we can see
But we have it in English,
that.
so that works.
Also, we are on this tour to educate pet parents how to take charge of their pets' health and lives. And thank you so much for empowering us and being out there. And I can't wait to see what you're going to do in the future.
You're so welcome. And I should mention just one note about the book. There is a whole chapter in the book about cannabis, and there is sort of step-by-step dosing instructions and calculations. So if that's something that people want to see, you will find it there.
Wonderful. Thank you so much.
You are so welcome.
I like to call myself the cannabis queen. If you would be my king, kinda. Cannabis king, ladies and gentlemen. Thank you so much.
Thank you.
Appreciate it, even though you went to Palmetto.
Oh, that's where we're going to go, huh?
Thank you, everybody. Stay tuned.
Bye-bye.